Senator Van Hollen.
Thank you, Madam Chair. And if I could ask at the beginning that 6 statements from well-respected organizations expressing their support for NIH be submitted for the record.
Without objection.
Thank you, Senator. And I want to thank Chair Collins and Senator Murray and especially all of you, the witnesses, for your powerful testimony today. I've been listening on C-SPAN, and I just want to thank all of you for being witnesses as to why the work done at NIH and FDA and other places is so important to kids like Charlie and to our country. And I am proud that my state of Maryland is the home to NIH and FDA, but I'm especially proud of the work they do on behalf of Americans and American families every day. And what we have witnessed in this first 100 days of the Trump administration is a direct attack on NIH and medical research. And what that means, and you've all boiled it down, is that puts more Americans in harm's way. It means less research into life-saving treatments, life-saving cures and treatments. And of course, at the global level, it simply opens the door to our adversaries like China, who has been working very hard to sort of emulate the American model. So whether it's a threat to U.S. innovation in the area of medical innovation, or whether it's the direct harm done to American families, what we've been witnessing is a danger to all of us. Ms. Stenson, I'm glad to hear that your daughter, Charlie, very cute, is cancer-free, and that she's back enjoying the simple joys of being a kid. Earlier today, you did talk about how these moments are not guaranteed for many families impacted by pediatric cancer diagnoses, but they are made possible by life-saving research Congress and this committee has invested in the past. So as someone whose family has been so personally impacted, as well as your support for others who are battling pediatric cancer, can you talk about what progress in medical research and access to clinical trials has meant to you and other families?
Thank you for the question and for your kind words about Charlie. Access to clinical trials is huge in our community. Many families move state lines just to receive treatment and to save their children. And rolling back access it would be devastating, and we simply can't do it. We need to be expanding access and increasing cures for our children. There's far too many families who do not realize a cure, and it's never lost on me that we got to because of NIH funding and clinical trials, but there's so much more needed.
Thank you for, again, bearing personal witness to the great benefits of medical research and also the dangers of cutting this area, in this area. Dr. Schleckman, I was heartening to see the photo you held up as a reminder of the importance of this work. And, you know, like others on the committee, I'm very worried about how we are going to completely disincentivize younger researchers from engaging in this life-saving activity, and the impact, of course, that we're talking about on clinical trials. So can you also speak broadly to the dangers that we will all face if we continue to cut back in these areas and discourage young researchers from entering this important field?
Yes, thank you for that question. I think, you know, we've touched on some of that today, but to crystallize that, you know, clinical trials and running clinical trials is challenging for the researchers who do it. There's an awful lot of regulatory and administrative activities that go into that. And I would say that they do it primarily driven by their love and their passion for being able to provide their patients who otherwise may have untreatable cancers with a possible cure. And again, 30 years ago, when we put patients on cancer trials, there really was no kind of upfront feeling that the patient themselves would benefit from that. They were doing it to help us learn about treatments of the future. But as I said in my presentation, there are thousands and thousands of patients, of people walking around today alive because they had a good outcome from a treatment that they got on a trial. And so the medical professionals at my cancer center and the others are committed to doing that. But there's a certain limit to that commitment. If the challenges are made insurmountable, they won't be able to do it. If money is removed that supports the services that help them open the trial, now make it much more difficult for them to open the trial, eventually they'll say, well, I have to take care of patients in clinic. I don't have time to do this. So it's critical that we keep things in place the way they are now.
Thank you. Thank you all.